Welcome to today's session entitled Complex Needs Through a Health Equality Lens. What can philanthropy actually do? Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to either join by phone call or computer audio. If for any reason you'd like to change your selection, you can do so by accessing your audio pane in your control panel. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send your questions in at any time. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce John Feather, CEO of Grantmakers and Aging and moderator for today's webinar. John?
Well, thank you so much, Kat, and thank you for all of you for joining us in today's webinar. This is actually a special occasion for us. We started this webinar series in 2012, and this is our 100th webinar in this series, so a great milestone to celebrate. We also want to welcome our friends at Grantmakers in Health who are participating today. And we want to say a special thanks to the 7 Foundations Collaborative for their support of today's webinar and work that we've been doing over the last few years with them. To improve the health outcomes and daily lives of people in America with the most complex health needs, these 7 foundations, which are Arnold Ventures, the Commonwealth Fund, the John A. Hartford Foundation, the Milbank Memorial Fund, the Peterson Center on Healthcare, the Robert Wood Johnson Foundation, and the SCAN Foundation, are working together to accelerate health system transformation. This collaboration aims to help healthcare organizations participating in value-based payment models and adopting evidence-based interventions improve outcomes and lower overall costs of care. Today, particularly, we're going to focus on issues around equity. The health and well-being of those who have faced a lifetime of structural racism are impacted much more strongly than other groups, especially as they age. For example, Black older people are dying from COVID-19 at 3.6 times the rate of older whites. Philanthropy has responded to many immediate needs, but if the system of discrimination and the social determinants of health does not change, then the same inequities will continue. Without strong philanthropic investment at the systems level, we may survive the current pandemic, but nothing will have fundamentally changed. Many agree with this proposition, but wonder how they can impact such broad and far-reaching issues at the local level. To assist us in addressing these difficult issues, we have 2 of the nation's experts with us today to discuss specific efforts to link together a systems approach with local activities on the ground. With us are Catherine Lawler, who is the Executive Director of the Atlanta Regional Collaborative for Health Improvement, or ARCHI, a regional collaboration to understand and transform the system that keeps Atlantans, particularly those of color, from achieving good health and overall well-being. She will be discussing the Invert the Burden model and the Atlanta Transformation model as specific examples of how local and regional communities can make a major difference in the lives of those that are usually left behind. Carly Hare is the National Director and Coalition Catalyst of Change Philanthropy, whose goal is to unify identity-based and identity-focused philanthropic affinity groups into an empowered coalition to integrate diversity, inclusion, and social justice into philanthropic practice, transforming the sector's culture to be one that embraces equity. She will describe the evolution of the philanthropy equity movement and will provide resources and toolkits specific to understanding underserved populations. We thank you both for being here. So Catherine, let's start with you.
Thank you, John, and thank you to all of the sponsors of this event for the opportunity to join with you today. We have found that always, but particularly this last year, it's so wonderful to learn and engage in dialogue since we are all striving to pave a new path, and it's very helpful to connect with others as we do that. As John mentioned, I have the honor of serving as the executive director of Archie. It's a 110 organization collaborative in the Metro Atlanta area that is bound together by a 28-year commitment to improve health in the core metro area, putting social determinants and health equity at the center of that commitment. What I want to share with you now is the reflections of that collaborative on this past year, as well as the previous work together, and how we are striving to invest in systems change while we are still living in a pandemic and responding to immediate needs, particularly of those with complex care needs. And so, as John already said, the data in our community is the data in so many communities across the country that people of color, and particularly in our community, Black Atlantans, are suffering much more from this crisis than so many other populations. But we continue to have these conversations about that COVID has laid bare these underlying inequities that were already there. And part of framing what I want to share with you today is sort of starting with laid bare exactly what. And in our community specifically, that means that it has never been easy for Black people to be healthy in our community. And this is just a handful of statistics that, again, we're not that different from that many other places. Fulton and DeKalb, you'll see those referenced. Those are the two core metro counties, downtown counties. And so we have always had significantly different health outcomes by race. But just like many communities across the country, we've had tremendous income inequalities in our community as well. We've also systemically uninsured folks in Georgia and in the Atlanta area, and that divides itself by race as well. And we could spend actually this entire time looking at a range of statistics, all which prove that same point. But in asking the question, well, what exactly has this crisis laid bare? What are these underlying issues that have risen to the surface for so many, sometimes for the first time? It is all of these statistic points. But I would put forward today that in our community, we are recognizing that this crisis has laid bare our two problems of resilience and race. And to break those out, resilience really is this understanding that there are relationships between all of the things in our community. And those dynamic relationships are what not only create goods, like a safe community, making it easier for people to have a good education, education being a good education leading to a better job, a job being a good, and so forth. But the resilience comes in the dynamic nature of these relationships. So in particular, that means that all of the goods and services in our community, which in the world of health are often referred to as the social determinants or social influencers of health, they are not unique items. They in fact exist within a dynamic system. And it is dynamic because it is moving, and it can either move people up toward opportunity, health, wealth, increased safety and stability, or those dynamic relationships can move people down, so depriving them of opportunity, health, wealth, safety, and these others. And this dynamic nature of the system is also really what has been laid bare. And in our community, the evidence is strong. It was strong before COVID that these things exist in relationship to one another. So you can just simply look at a map of the city of Atlanta, and we look at one health characteristic on the right, diabetes, and no matter what socioeconomic data point we look at, the maps are very much the same. So income or living below poverty, or people who are paying more than they can afford for housing, folks who were not able to get a high school diploma, single-headed households, these all resemble the map of diabetes. And so these things parallel one another. They exist in relationship to one another. There are cause and effects. And it's these relationships that have been a really critical part of creating for some resilience and depriving others of that resilience that has been laid bare by this crisis. But in America and in Atlanta, what is also an element of this dynamic nature is what has been depriving people from access to resilience. And in our community, because of the choices that we have made, the practices, the policies, and the prejudices that we have held, Racism plays a really strong part in this dynamic system. Racism creates blocks, it lessens the quality of the goods in this dynamic system, and it therefore deprives individuals of the things that we know that they need, ultimately creating resilience, but opportunity, health, and wellness. And we know that this is true as well by the data. So for example, we in America and certainly in Atlanta made choices about how we invested all kinds of dollars, and over and over again, those choices disproportionately impacted people of color, and in our community, Black Atlantans. So for example, we drove each of our highways through Black neighborhoods, and it doesn't matter if you know where these places are, but I can show you that on the left was a thriving Black community in 1949, and we put our downtown connector right through the middle of it. That's a picture from 2014. We did the same with the very, very famous Black community in Atlanta called the Sweet Auburn area. Again, drove a highway right through, depriving folks of access to critical services and goods. We also have a history, like so many other parts of the country, of depriving particularly Black people, but people of color, of access to mortgages, the practice of redlining. And again, I know many of you are very familiar with parts of this history as well, and that this is a map of Atlanta and the neighborhoods that were primarily Black neighborhoods where you could not get a mortgage because of the practice of redlining. And then, of course, in the South, but all across the country, we have had a long history in the healthcare and public health world of treating people of color with tremendous disrespect as experiments, depriving them of access to critical goods and health. And the Tuskegee is just one of many examples, but it's a really critical part of our community's history in the South as well. And we could, again, go on about the evidence, but we know that it is racism that created the policies that are flowing through that dynamic system that mean that some folks have the opportunity to have wealth and stability, and other people, particularly people of color, do not. So in thinking about how to work in and invest in equity in this time and in this moment to make a difference, I wanted to just share a couple of examples from on the ground. And so to answer the question about how to do that, we explore a couple of things: how we might change our processes, because the system is getting the results that it was designed to get. Many of you have heard that phrase before. And so the system itself, even the system of care, of nonprofits, of community services, is a part of creating those inequities. The pipeline has to change as well, because we don't have enough of the goods and services that people need. And because of our history and our likelihood that to repeat our same mistakes, it's very important that we understand how COVID-related investments, stimulus, and other policies might be impacting people of color. And so I wanted to share with you how we're doing this in Atlanta specifically. So one, it begins with this recognition that in this dynamic system, the burden of navigating all of these different issues and needs is fully and completely placed on the individual. And anyone who works in a nonprofit will know that most of the services are disconnected and siloed, and individuals receive an assessment and referral sheets to go find different services, appointments that aren't set, phone numbers that don't work. The burden is fully and completely placed on the person to access a whole lot of very complex systems. And so in Atlanta, we are working to invert the burden, moving the burden of navigation away from the individual to the system itself. And it's based on many principles that folks on this webinar are familiar with, but it really begins with meeting people where they are and coordinating the care around the person, not waiting, making them navigate all of that on their own. And we have lots of great examples across the country that we have been learning from, particularly through the National Center on Complex Care and other great experts from around the country. And we have deduced a series of operational practices that this is really not just a concept or a nice phrase, inverting the burden, but it actually means you have to transform your operation. And these points in the middle are elements of that transformation, including the way data is shared and how handoffs are occurring between organizations. And this is alive and well in a number of partnerships that, even though they had bumps in the road with COVID and had to learn how to operate differently, we're running these kinds of invert the burden models all across our community right now. So one example is the community resource hubs, where patients at a series of FQHCs, Mercy Care, or Grady, our very large public health system, public safety net system, patients with chronic conditions are identified, they work with a community health worker, and then through a closed referral network, they're receiving access to services through a wide range that meet them where they are through warm handoffs, appointments, and data sharing. They don't have to repeat their story over and over again. Information is shared so that it is not in service of the agencies, but in service of the individual themselves. We have a couple of examples that have just popped up this year specifically to address the needs related to COVID. And so just to give you an example again of how the system is taking on the burden of navigation, we call this the Health Housing Solutions Squad, where we have agencies that are meeting on a weekly basis to knit together the health and housing services that individuals with chronic conditions need in order to successfully transition from homelessness to permanent supportive housing. So those are two very diverse sectors, health and housing. It takes work to bring them together. And that work is being borne by the agencies themselves. They meet in partnership to solve problems, to get through hurdles together and find ways of getting around rules that don't seem to make sense much anymore. We also have meeting on a weekly basis all of the downtown hospitals who meet to convene to support the social determinant needs of their patients and finding new ways to connect with community services. So they are able to begin to build that bridge from the health system to the community system by meeting together in partnership and again, holding the burden of navigation on themselves rather than on the patient through referrals or phone numbers or the other ways that we have historically delivered services. So this is a way of right now in real time trying to invert the burden in a simple way. But we also recognize that we can do a lot of work inverting the burden and bearing that on the system, but we won't truly do that if there are no services to send people to. And so Archie has been supporting a team of health systems and insurers that have been working together for almost 2 years now to develop a joint investment strategy where they can join all of the different resources in our community that are trying to grow the supply of affordable housing. Because these are the critical services that are greatly impacting our Atlanta residents that have certainly come to the head in COVID. But it takes a lot of work for them to come together to build a strategy and consensus and to find a way that they can cooperatively join the investment pools and grow the long-term supply of affordable housing in our community. But it is working. And then lastly, of course, we know that we have a long history, both in Atlanta, but across the country. But Archie, as a collaborative, has been studying for the last 3 years our specific history, the practices, prejudices, and policies that we have adopted over many decades and centuries that have really made it much more challenging and have held back people of color in our community. And so as we headed into this year, particularly with the pandemic, that was more apparent to many, but the partners, the Archie Collaborative, have been working together to explore and understand that reality as well. And so as we go into this new way of working, trying to figure out a new way of investing and moving forward, that history has been really important. And these are just two examples of some of the work that we have studied together. And knowing our history and knowing our likelihood to repeat our history is at the forefront of our concerns in our minds about what is the long-term policy changes that we need to put in place so that we are truly inverting the burden, not just for this individual as they are accessing services, but for the next generation. And that is definitely playing out in real time, as we can see. So, just on the left-hand side of your screen is a whole range of federal, but also local and statewide policies that has been adopted over the last century that have aided whites and or negatively impacted Blacks. And we are terribly cognizant of that impact, that many of those policies and programs were lauded as critical advancements, big steps forward, but without ever recognizing that they were big steps forward, but steps forward only for some. And as we are developing policy right now about how we're going to recover from the pandemic, how we're even going to distribute the vaccine, we feel very strongly that we have to be aiding and pushing that so that when the story of this intervention is written, it is not the same as the GI Bill, or they're not showing the new redlining maps when it came to vaccine distribution, but in fact, we're talking about how that was done with equity and it lifted all people, but particularly people who have been held back. And so amongst a couple of agencies, we are developing a team of health equity fellows that can support all of us in growing our talent and expertise in this area, because it's not easy. It's being done in real time and everyone has a lot to learn. So it's wonderful that we can do it together and draw on the talent and expertise, not only of professionals, but of individuals with lived experience through these fellows as well. And so I just wanted to close, and I look forward to hearing from Carly and then answering your questions as we move forward.
Noah, Tatasa Carly Hare, Tatasara Kirida Hudacharix, Pawnee Yankton. Good afternoon. My name is Carly Hare. I serve as the Coalition Catalyst and National Director of Change Philanthropy. We are a national organization, as John mentioned in our opening, that is a coalition of 10 organizations and partners moving the work forward around philanthropic equity. Could you go to the next slide? Those 10 partners begin with our legacy members, which are the racially based and identity-based affinity groups that have been in the field of philanthropy, and that includes the Association of Black Foundation Executives, a philanthropic partnership with Black communities, the Asian American Pacific Islanders in Philanthropy, Funders for LGBTQ Issues, Hispanics in Philanthropy, the National Committee for Responsive Philanthropy, Native Americans in Philanthropy, and Women's Funding Network. And those were our legacy partners. You may have known us if you've been in the field for a while as the Joint Affinity Groups. And in 2006, we rebranded, expanded, and really honed in some really specific focus on how we can help move the field and practice better by building knowledge, fostering diversity, and creating connections. One of the things that I think is always helpful for folks to understand is that as we move through this work, we are independent organizations. You can go to the next slide. That our 10 partners are independent organizations with their own mission, action plans, influence, and membership bases that support the field, similar to Grantmakers in Arts and Grantmakers in Health. But we work together in a very interconnected way to help deepen opportunities, conversations, and moving ideally foundation institutions and individuals along their journey towards equity. You can go to the next one. So I just want to do some level setting on language before we begin, because we get into this work and DEI has been a thing that we don't have to whisper at the water coolers anymore as it relates to our work in philanthropy. However, while we're having these conversations in public and on stages like this, virtually and in person, we often conflate and confuse some of the framing and the language. So I just want to have us have our frame around it, what it means in philanthropic roles and opportunities and relationships to move that forward. So really clarifying at the beginning of the spectrum is diversity and inclusion. Diversity is the mixture of the people you have that are involved in the conversation and in the space and in your institution at the board level, volunteer level, at each of those levels. Inclusion is the culture and climate that you create and the environment in which you host and navigate your philanthropic activities. And as institutions, how we navigate that space. So the people and the place and culture that we create within that space. When we move into the next conversation, as Catherine so beautifully outlined what inequity really can look like in many of our communities. I think one of the newest iterations of the visualization this year has been this giving to reframe of the spectrum of equity, thinking around inequity and what the unequal opportunity and access that folks have, the policies and structures that make that possible. When we look at equality often, and that's typically the first step for many foundations, you may have never funded some specific communities in the past. By funding those, that necessarily isn't equity, but it is equality framing and moving your conversation forward and in addressing and expanding your area of impact and your relationship network. Once we move through equity, we think about, or out of equality, we think about, well, how do we really address the equity piece? And that's about looking at the tools that we can actually use to adjust the access to those resources. That doesn't necessarily look at full systems change or to the same degree. So thinking about equity is like, how can you step in to mediate those gaps, to mediate the issues and the concerns that are happening in the community? And then justice really is about changing the reality, focusing on the structures and the systems that that make those inequities will have power in our communities and power in the work that we do. As we take it a step further, is really beginning how we overlay the conversations and the resources around deeper conversation and tiers. So thinking about intersectional equity, and the Women's Foundation of Minnesota put together this beautiful framing around intersectional equity, that it is the overlap of race, gender, place, and additional identity factors. That is the Venn diagram, and examining operations, research, analysis, and implementation of how your programming is impacted in that space. As we dive specifically into how you can take a deeper look into your work, and how the programs and policies you might be funding and could look differently, thinking about it through a racial equity lens or versus a racial justice lens. And the Philanthropic Initiative for Racial Equity has published the Racial Equity Lens in partnership with Grantcraft, and then an independent piece on grant making with Racial Justice Lens that really differentiates between what is equitable funding that actually gives you, where you have the information, you're looking at the disparities, you're making choices that might impact and understanding the problems and the root causes that cause them, and you're explicitly naming the community of focus. Whereas racial justice really looks at understanding the deeper analysis of the racial history. You are creating an affirmative vision of a fair and inclusive society. You really are explicitly looking to invest in civic, cultural, and political power building for communities and individuals, and you're emphasizing transformative solutions that impact larger and multiple systems in that space. And as also highlighted, we know that COVID has exacerbated the inequities that exist. We know that independently, the communities, particularly of color, are significantly being impacted at a higher rates. And we know that in many of those dimensions of how what the issues are related to testing, to economic status, to geographies in which they live, and the access to resources, their housing and other social determinants, as Catherine laid out before, are really important. But how do we as philanthropy really take a look at addressing this? And with that, it really is about understanding what is being mapped out by community, with community, and what are the recommendations for philanthropy to move in that way, to move in response and in partnership with them. So I'm going to highlight a few of the pieces that we know that have been navigated, that have been presented during this COVID window and COVID response window, and encourage you to think about these resources as tools and organizations to connect with. Our partner, APFI, has really moved forward some work around organizing Black Foundation executives over the last year and even prior to the COVID and racial and community reckonings that have been happening this year, and really put forth a recommendation of request to philanthropy of how they can support anti-Black racism. Or how they can address anti-Black racism within their grant making and within their structures. And additionally, they've also pulled out resources that are specific to aid related to COVID response and the public-private policy opportunities within there. I'd also encourage you to check out the Urban League, National Urban League, and their State of Black America, which gives a very nice framing. And the Movement for Black Lives has a COVID-specific national demands that are considerations for moving the conversation forward. As we move into Latinx communities and framing, Understanding the breadth, depth, and diversity of Latinx communities is a good start. Understanding the disparities in which communities are navigating the spaces. So I'd encourage you to check out the COVID-19 impactdisparity.org, which is a partnership between Hispanics in Philanthropy and Ross Sismo Mix, which will give you more information about Latinx communities, programming and resolutions, COVID relief responses, and partnership opportunities specifically addressing Latin America, Central South, and the Latinx population in this country. As we move into another frame of community focus, thinking about then AAPI communities and how AAPI communities have been impacted by COVID. Asian American Pacific Islanders have released a statement and resources related to that. They've also launched a giving circle as part of a response fund. There's a larger research project around AAPI COVID project, if you can find more, where they're coordinating the actual information, because the AAPI specific data is some of the hardest to specify and find in our national tracking, and that is part of how we build our surveys and continued inequities, is that we often have identification for Black and Latinx population identification, but don't always include Asian American Pacific Islanders or Native Americans, or group them together as other. So the AAPI COVID project really looks to unpack what the actual data and research are around the impact to Asian American Pacific Islander communities. And because of the additional challenges into the xenophobia that was brought around with COVID, there is also, I would encourage you to check out the Stop AAPI Hate, which is addressing a lot of the xenophobia and hate and fear-induced reaction to individuals and institutions that identifies AAPI. As we think about the other population that often gets othered, as I mentioned, is Native Americans. And there are a number of resources as well that are really looking to have a deeper understanding and connection to the work. Earlier this year, Native Americans in Philanthropy, the Circle, which is the Canadian counterpart to Native Americans and Pacific Islander, Native Americans in Philanthropy, and the International Funders for Indigenous Peoples collaborated to really set forth a joint statement on challenging philanthropy to sit in the 4 R's of Indigenous philanthropy: respect, reciprocity, responsibility, and relationships, as you think about navigating COVID response relief and relationship. Native Americans of Philanthropy has launched a COVID-19 a resource center. So if you are looking to invest in Native communities, it is a great place to start. If you need data around how they impact, it's also as a holder for that. And then there are other regional outreaches looking to address national programs looking to address Native populations that are Native-led, and that includes First Nations Development Institute and their COVID Emergency Response Fund, Indian Collective, and their COVID Response Fund are 2 that I would highlight that have national impact but are reaching regional and localized communities across the country. After we take a look at the kind of race intersection of the work and what has been happening, also looking at the other layers of identity and components of identity, understanding how COVID is impacting LGBTQ community members, is also an area we need to really unpack as communities who are significantly challenged by access to healthcare in varied varieties, and then also having a deeper analysis around what it looks like and how folks are navigating COVID as part of their, particularly folks with who are trans, and navigating the space of resource support in those windows. And Funders for LGBTQ Issues has a beautiful, also curated space of resource tools, other giving related component or other response funds that have been organized to address the various identity and community groups within the LGBTQIA spectrum. And we cannot forget to include a gender analysis lens as well, and thinking about what it means and how COVID is impacting women specifically, and women identified people in in the work. And Women's Funding Network has put together a list of how philanthropy is responding with a lens to funding that is supporting women. And they've actually created their response recovery and resilience collaborative fund as one strategy to help support that along the way. In addition to those community-specific and focused resources, there are a number of other challenges to the field to be in better practice around what it means to be a funder in this moment, how it means to respond during a high stress and pandemic moment. And I would just highlight a few of those. Earlier this fall, and about 10 national philanthropy serving organizations partnered to present the call to action, challenging philanthropy to commitments during COVID-19, and that includes different ways to practice your grant making, different ways to be in response, and different ways to partner with your grantees. And it is a list of, I believe, 8 challenges to the field that are about transparency, openness, response, and relief frameworks, and how to be in better practice related to that. We also have seen independent sector, the Council of Foundations, pull together resources specifically for how funders can be in partnership with nonprofits and community organizations within the general COVID response frame window. The National Center for Family Philanthropy has put together a guide of resources specifically for independent and family foundations and smaller foundations. The Center for Disaster Philanthropy has really stepped into a leadership role within addressing the COVID response, and has a new report partnered with Candid around the first half of the 2020 and philanthropy's COVID response to COVID. Candid, formerly the Foundation Center, also launched a platform that really identifies COVID response, relief, resources, ways to plug in thought pieces related to philanthropy's role in the work. The Center for Effective Philanthropy has created rapid response feedback tools, a tool that you can use with your grantees to understand how they are responding and what they are doing. And then the United Philanthropy Forum this year was tapped by Gates Foundation to help address the call in and the lean in of many community organizations to provide response and relief funds in community. And I was fortunate, and John was as well, to serve on the planning and design team of that, to really be explicitly and unapologetically focused at communities that have traditionally held limited access to healthcare and are living in those inequitable gaps across the spectrum of most of the funding areas in philanthropy. So we identified this process. An open call led to over 775 applications that all qualified. We narrowed that down to 400 that were more specific to the filter of community of uninvested, traditionally underinvested in communities. And from there, we were able to fund just over 130 organizations, and have been working to amplify an additional 125 organizations that didn't get funded but are doing amazing work in addressing their community needs. So if you are looking as a funder for resources and places to plug in, there is either community specific programming that I've spoken about and resources that you can tap into. There are some collective and collaborative funds you can already partake in. There's some best practices you can identify that have been outlined for how to shift your actual practice outside of just where to move money. And many of these recommendations will be useful moving forward in just philanthropic equitable practice as a best practice, not just in a pandemic moment. And finally, if you have any questions or comments, or if you have any questions about how to access the organizations that are in our partnership, you can find links to all those at changephilanthropy.org, and you can find plugins to those resources. Almost all of these COVID response issues are on the front pages of most of our partners' work, for sure, and then the other philanthropic partners that I mentioned as well in the field. So hopefully the framing around how we think about where to plug in, what equitable partnership looks like within philanthropy, and then where the resources are to help you be in partnership, think differently about your actual practice, and how to move collective and collaborative funding within this moment to have a significant impact and have a targeted impact. We've laid out, and hopefully you'll be able to find one that is able to connect with the need you're looking for and a community you want to address. And thank you, and look forward to hearing if you have any questions.
Well, thank you so much, both Catherine and Carly. This really outstanding presentations. These are complex areas, but you provided lots and lots of resources to help people connect to ongoing examples and what other people are doing, and that's an essential piece here. I do want to say at this point that we will be providing the presentations, both the slides as well as the audio, to anyone who wishes it, and we will be sending you an email about that. So I know there was a lot of information on these slides, and we want to make sure that you have access to all of it. But we do have time for questions now, and you can still enter your questions into the question and answer box that you see on the pull-down menu on your screen. So please go ahead and do that. But Catherine, we have basically a bunch of nuts and bolts questions for you to sort of tell our audience a little bit more about how your efforts are organized. So could you talked about there's over 100 members in your partnership. What kinds of organizations are they? How do you fund yourself, and how sustainable has that funding been, and do you feel that it will be fundable going forward, which of course is essential given the kind of long-term systemic efforts that you're trying to make? And also a question about how are you engaging both local health systems as well as other governmental agencies. Of course, you were the director of the aging services for the Atlanta region before this particular job. So I know you have a lot of insights about that too. So any or all of those questions we'll punt over to you.
Great, thank you. So of the 110 organizations that have joined the Archie Collaborative since it was started 8 years ago, about 30% of them are what you would consider traditional healthcare. So they're either some of our major health systems, insurers, we have some individual physician practices, folks who are delivering traditional healthcare. But the other 70%, we work very hard to make sure they represent the full spectrum of the social determinants of health. So we have partnerships with our transit agency and many housing organizations and employment assistance, food and nutrition, community gardens, and folks that are thinking about local land ownership and gentrification. So it is a very diverse partnership, and that is intentional. It's something we monitor, and it's been organic so far, but if it ever we needed to put more effort into continuing that diversity, we would do that. We have engaged with those partners in a variety of ways. In the old days, is that what we call it, we had large convenings so that everyone could come together at a minimum quarterly, but we began to increase that frequency to learn together. And those learnings were always designed to focus on cross-sector issues and our history around equity. So it generally was tried to design to be something that no one sector or organization was an expert in, but something that we all needed to learn together. And that is the most often way that people engage with us. But Archie also is there to help support when folks want to do something across sector. And there's a big difference between wanting to do it and making it happen. And so we are there in the complete in-between space. So sometimes it's just meeting the right people. And at the other end of the spectrum, it's full out running these innovative programs like the Community Resource Hub. So we are the neutral ground for all of those partners to come together, sometimes even competitors. When we've had multiple health systems working together, they really need that neutrality. And that's where we bear the risk of the innovation. So, the project may or may not work because it was a wild and crazy idea. And no one wants to go down with that alone. So Archie bears the risk of that innovation. And help support the work together so that no one agency has to go out on a limb when we're trying to do this level of systems change. And to that effect, our local health systems were part of the founding of Archie, as was the United Way, as was the Regional Commission, which is our collaboration of local governments, as was our public health department. So they all maintain very active engagement in the collaborative, even in this, as we have all tried to adopt our new ways of working together. So far, just on, and I know this is a long answer, but trying to hit all the points. In terms of funding, it comes from a wide variety of sources, but the founders of Archie provide a small pooled body of resources for operational dollars. But Archie is designed to be the rocket fuel behind its partners. So it's intended to be a light infrastructure where the work that is being done is done primarily through the partners, so that it is also a collaborative that never competes with its partners. So we're there to help each organization be 6 inches taller, I always like to say, or do the thing that if they had more hours in their day, they would do. And so to that end, I guess the only way I can answer is that it has been sustainable so far. But that's always a fair question, I think, for any nonprofit and certainly collaborative effort. But so far, so good.
I'll ask you one more, then I'll move over to Carly. Are there other regional collaboratives like you in other parts of the country?
Yes, there are a number, and we have the pleasure of working with some of them very closely and are always on the hunt to discover and meet more. So actually, John, you facilitated recently a connection with us and our near neighbors in Nashville, which shame on us for not having known them before. But we also work with collaboratives in Memphis and in the Bay Area, in Chicago, in Denver. And so I think this is increasingly becoming a way that folks want to work together because of this recognition that health is never going to be achieved, or the kind of resilience we know we're going to need to overcome inequity if we only work with healthcare. We've got to do these multi-sector collaboratives in order to try to start to see some population level change.
Thank you. Carly, here's a question for you. For those who are not deeply engaged in this work historically, one of the stumbling blocks is often language. And you did some wonderful work and at the beginning of this presentation, trying to level set. Is that something that you always do? Are there really good resources that could help us better explain what we're talking about when we're talking about these issues?
Yeah, I think it's something we try to do for sure when we enter into newer conversations with partners in the field, so that when we are using language in collaborative and partnership exploration spaces, that we are within the same, not only using the same language, but mentally mapping out the same kind of impact and opportunity. I would also share additional tools that are great to access if you haven't, are racialequitytools.org. That is a beautiful orchestration of work, and there's some really nice pieces within there, particularly related to COVID, as well as in this moment of community organizing and the racial reckoning that we've seen from the summer, and that continues to move forward in many communities. And healing work in that space too. There's an additional set of resources that are helpful to understand thought pieces, some more kind of glossary and lexicon to think deeper and to have more tools in your available to you as you navigate the space. But that also is a great broad for your grantees if they're exploring it as well. It's got some action planning frameworks and steps to think through as you move into the conversation. And the one thing that I was remiss in the overview is also like, how are we going to be caring for our nonprofits and our community partners in the back end, and how are we going to be reconciling some of the shifts that we've done? And one of the things that is newer in the last 5 years is the Equitable Evaluation Initiative, which really challenges philanthropy to think about why and how and what we're asking from our community partners and grantees, how we're making that data accessible, and how we shift from a traditionally extractive process in community into be more of a community building and collaborative process together. And particularly after this round of this year and the impact and the resource moving that has happened, thinking about how we are in partnership in a process that supports our community organizations move into stability and after we get out of the sunset from the very closely almost done year into next year and solutions work.
Thanks. I'll stick with you for the next one. And this is asking a question about for those groups, including those who are your members in Change Philanthropy that are on the forefront of these issues. How are your members helping to provide opportunities, but also to encourage opportunities to hire Black, Latinx, and other folks into the philanthropic world? And I know that there's specific groups that do that, but could you talk a little bit more about how you're doing that?
Yeah, so that's been an issue that all of us came into the sector as a support for people of our respective identity groups. And actually the grandmother of every philanthropic serving organization in the country is the Association of Black Foundation Executives as the matriarch of moving, organizing community work forward. And it was particularly around how you promote opportunities for leadership in the field. So at a Council of Foundation meeting, there was a slate of Black executives that was submitted for review to join the board. Not one of them was accepted in that slate for that year's cohort of board members joining through their process. And there was an active protest in 1971 where the folks who became the founding members of APFI walked out of the council conference. And so that piece of like, how are we diversifying the field has been something that we have been grappling with and challenging in the work. And it is a multi-directional piece that many of our partners actively support. There's leadership programs that are offered by a number of our partners and fellowship programs to help people navigate the sector itself and move into more and deeper and higher and the opportunities to impact the sector. And then we're often always seeing many organizations have started fellowships to bring new people into the sector. And the one thing I would encourage folks and foundations that are exploring this is to be aware of your own culture climate work. You need to do an analysis work of where you're at as an organization, how much of a welcoming environment have you created, what are your policies and practices that engage folks to participate to their fullest degree, and to bring the components of their experience and identity into the work. And I would just share, we are currently in the window of our Diversity Among Philanthropic Professionals survey, which asks deeply individuals that work at boards, work at the staffs of foundations or on boards of foundations to share their identity factors. It's anonymous and confidential. We've also included a question this year that is about the spectrum of how their institutions recognize and receive the components of their, or how their components of their identity are received in their institutions. And it's a spectrum that ranges from the positive end of actualized, celebrated, acknowledged, through the more negative end, which is ignored, invisibilized, and exploited. And thinking about like what are the culture and climates of our institutions within there. So we have worked to develop this tool that will serve as a pulse and temperature check for institutions around where their staff and boards are feeling as it relates to the full spectrum of identity, age, race, ethnicity, orientation, disability status, faith, practice, tenure in the field. We're chronicling kind of a range and the positions that you hold as well, and the access to power and influence that you have within that space. So we're excited to see and continue to support that internal climate and culture shift change work that many foundations are navigating, and we know that is key to really bringing more and keeping more people and diverse background and experience into this work.
Well, thank you so much. We only have time for one more question, then I'm going to come back to you for your final words. But it's a wonderful broad question. So let me ask you both this question. I'll start with you, Catherine. Do you feel optimistic at this point around these major issues? It's been an incredibly difficult year, but it's also been a political climate that's very divided and so on. So are you feeling optimistic about moving these major systemic issues forward?
I am feeling optimistic because I think that there's a lot of of work ahead, and it's going to take multiple generations commitment to do it. But what I'm seeing is that the two things that make me optimistic is that despite what this year has been, people are still putting energy into this work, and they are doing truth telling with themselves, with their organizations, and in their community. And I think as we finish the year that we've had, the fact that those two things are still strong and emerging, that people are putting time and energy into this, they've not said it's so overwhelming, I gotta shut down. And that at the center of that is the truth about our communities, truth about ourselves, truth about the decisions we've historically made. Those two things make me very optimistic.
Thank you so much. Carly, how about for you?
I feel there is such a moment of momentum that we have built to in this year, because of the various conversations, because of the response, because of the leadership on the ground of communities in this work. I will say that there is a continued commitment of time and energy into this work, and the truth telling is really powerful and important. I would encourage folks to think about the emotional, physical, and institutional weight it takes for people to be in that, particularly people of color, particularly women of color in leadership and organizations, that wind up being the emotional labor doulas for many people's work and practice in here. So thinking about how you're creating space for rest, relaxation, rejuvenation for many people who are leading this work and are leaning into the momentum of this work. And while there is really positive momentum and energy moving forward, there's going to be more time. There's going to need to be a time for rest and rejuvenation. And I just want to make sure that we think about the responsibility we have to providing that, given the amount of emotional labor we've asked folks to carry, particularly in this year.
Thank you very much for that as well. So we're coming to the end of our webinar today. So we want to ask each of our speakers to give us their final words of wisdom. And Catherine, we'll start with you.
I want to share, I guess, as much to myself as to anybody else who is gathered here, that I think as we are looking ahead, plotting what the first 2 quarters of the new year are going to be like, or if you're trying to do strategy for even 12 months, that there are 2 things that are really hard, but I think that's what we're being called on to do, really hard things right now. And so everyone's here, the title of this webinar, Complex Needs, is about the first one. So how can we support continual embracing of the complexity? Just as human beings, we are designed to like simplify and get to something you can count or put your arms around. But this moment is challenging us, and because of our history, to live in the complexity of these times, of the decisions that we've made, of the inequities that we have created. And it is one of the hardest things to do, is to stay in the complexity of it. But it's a mistake that we often have made in the past. We oversimplify, then we think we've got the solution, and then we look up and things are no better and probably sometimes even worse. So I think living in that complexity and doing what Carly said, trying to support people in doing that, is going to be really important in moving forward. And then second is that we actually can start change tomorrow, and that is by changing the way we work. And it is so unsatisfying to say we're going to invest in process, but process change is the beginning of systems change. The products are essential. We need to keep delivering pounds of food. We need to get Wi-Fi to all these kids trying to work at home. We need to get supports to the moms who are doing 3 jobs, trying to balance it all. Those products are essential, but if we don't change the way we work, they will keep flowing through the system that has created these inequities anyway. So I would just say those 2 hard things: continuing to embrace the complexity and to go ahead and investing in the way we work, not just what we're doing. I would challenge myself and everybody here to keep doing both of those moving forward.
Thank you so much. Carly, how about for you?
Wonderful. So I think building on that complex needs framework is understanding that in that complexity, there is an additional layer of nuance. It's understanding what each community-led solutions are. It's stepping back as philanthropy from what we have comfortably and traditionally stepped into for the last 120 years of organized institutional philanthropy, is having a crafted solution or goal or strategy in mind before we bring ourselves to the table or we ask people to join our table, but really is thinking about what is that community-led solution? What is the nuance we need to be available and responsive to within the moments? And then what are, as Catherine beautifully outlined, what are these determinants and components within the health equity lens that we need to be mindful of creating systems change and process engaged opportunities for folks, because people are stepping forward and doing amazing work. The mutual aid network and how they have responded and connected across the country has been beautiful and glorious to watch. And many folks are completely unaware of it, particularly as funders, or don't traditionally fund that type of work, but don't, and so they're missing how this collective community care process works.
Well, thank you both. I can't imagine on the part of Grantmakers in Aging and Grantmakers in Health that we could have had a better 100th webinar than this one. This is just really wonderful. So I want to thank Catherine Lawler and Carly Hare for being with us today and for all the work that you do throughout the year to make life better for those who have been left behind most of the time. We also want to thank the 7 Funder Collaborative, Arnold Ventures, the Commonwealth Fund, the John A. Hartford Foundation, Peterson Center on Healthcare, the Robert Wood Johnson Foundation, the SCAN Foundation, and the Milback Memorial Fund for their support of this work, and for our partners at Grantmakers in Health. We will be making this presentation available to everyone, as I mentioned before, who wishes to view it later, including both the slides and audio. So watch for a rebroadcast link on our website. And also join us for our next webinar next Thursday, December 10th, called Care Partners, Bridging Families, Clinics, and Communities to Advance Late Life Depression Care, Lessons Learned. You can learn more and register at our website, giaging.org. And finally, I want to thank all of you for participating in today's webinar. Have a great day and stay safe.